Chronic pain is common, and it's unfortunately a challenge. Whether it's from chronic arthritis or chronic low back pain or nerve pain, whatever the cause, patients are understandably contacting family doctors for advice. And one of the problems I see as a family doctor is we'll give a menu of options, the complete list of options to do, with emphasis on things like physiotherapy and physical activity. But often the patients will call back in a few weeks asking for advice, not having actually tried the things we've suggested. So I was going to make this video to emphasize this is the menu of options for chronic pain treatments. So go to my webpage at stewartmedicine.com and search for the chronic pain page. Scrolling down, you'll see one of the big emphasis areas is physical activity. This is at the top of every single chronic pain guideline and recommendations. Get exercising. Think of it as shaking rust off the joints. Can't emphasize that enough, that chronic pain is best treated with physical activity, whether it be exercise or even physiotherapy. These are the treatment guidelines for chronic pain. And you'll see in the columns the major areas of arthritis, chronic low back pain, or nerve pain, also known as neuropathic pain. And you can see again, at the very top, physical activity is the number one best option. And then as you go down, you can see that things like for arthritis, steroid injections, intra-articular corticosteroid injections are some of the most helpful. Then you get into what are called the SNRIs categories with something like Cymbalta, oral anti-inflammatories, which are also known as NSAIDs. And then you go down and you'll see that some of the things with less benefit or less evidence, glucosamine, Tylenol. At the very bottom, opioids have no evidence. Actually, the evidence is that there's more harm than good from treating with opioids or even cannabinoids. This is the complete menu of options. So if you're dealing with low back pain, for example, this middle column is the complete list of all options and the menu of options for chronic pain. As doctors, we often wish we had the immediate fix, the immediate solution to your problems, like the magic pill or a certain injection that would fix everything. But often that's not the case. So when it comes to chronic pain, this menu of options that I've just given you is the complete list. So if I've seen you and I've suggested try this or try that, but you contact me again in a few weeks and you haven't yet tried those first solutions, this again remains the list of options to review. So if you're still having chronic pain, review this full list of options and see what maybe jumps out at you as the next option you'd like to try that you haven't yet.